Hello everyone, this is me, Kristel, and so if you guys want to know more about my personal tips for OSCE exam, please stay tuned and continue watching this video. ANTT, or aseptic non-touch technique. What are the important things for ANTT? Things to remember. First is that it's better to alcohol more than the required times of alcohol than to alcohol less. Okay, so hand washing is very important. So it's up to you if you want to use hand washing or just alcohol your hands and do the hand hygiene. For me, I prefer the alcohol because it's easier for me to do it. Just mention the 7 steps of the hand hygiene and then that's it. That's the first thing to remember about ANTT. The next one is your material. So this is not just for ANTT, but this goes to all the steps and procedures you are going to do in your OSCE. So make sure that you will alcohol your hands before and after preparing your equipment. They said ANTT is the most difficult among the procedures in OSCE. Well, it varies to different nurses, you know, because some nurses find it simple or easier. For me particularly, because all my nursing experiences were inside the special area, so neonatal ICU and operating room or theater. And we do aseptic non-touch technique, or yep. So alam mo yun, it's kasi familiar na ako dun sa sterile technique, so it's much easier for me to do it. IM injection and subcut injection. So I will just combine these two. Just don't be confused, right? So please listen to me as I go through each and both of them. So I'm gonna start with IM injection. Never forget to perform the full ID check. So your patient, so I have a mnemonic for this. It's hand, name, date of birth, allergy, and then hand washing. Okay, so it's not really hand yung sequence niya, pero remember nyo na lang, hand, nandun lahat yung letters, the mnemonics. Okay, so again, it's hand washing, allergies, name of the person or name of your patient, and the date of birth. Verbalize that your trolley should be cleaned and it has been cleaned for the past 24 hours, and of course it is ready to use. So, while preparing the medication, you need to verbalize and then do it at the same time the resheathing of the needle or recapping, rescoop. So use the scooping technique or scooping method. So never hold the cap of the needle. You need to verbalize that you are doing the scooping technique or scoop technique, scoop method for resheathing the needle. That is a very important tip. All right, next, when injecting the medication, of course we all know that we need to locate the acromion process, and then to finger breaths you will draw an inverted triangle and then target the middle part of the triangle. Okay, so dart, it's up to you if you want to mention the bevel up. Okay, so pwede, pero yeah, but during when I practice I don't usually mention it, but I know that there's bevel up, so it's better for you to mention your needle's bevel is up, so bevel up. Next, gentle pressure lang, and then you need to put the plaster according to your patient's preference. So if the patient doesn't need a plaster, then no need for you to put it, just leave it open. Now for subcut naman, if IM is 90 degrees, subcut is... Okay, so both of them, subcut and IM, are using 90 degrees angle, 90 degrees. Alright, always use 90 degrees. What's the difference? First, IM should be, you need to stretch the skin, stretch IM, that's IM. Stretch and then dart at a 90-degree angle. Then, pag subcut naman, you pinch. Yun lang yung difference nila. So, you don't need to remember 90 or 45 degrees or 15 degrees or whatsoever. Not 15 degrees because 15 degrees is for the intradermal. Anyway, so don't have to remember 45 or 90. Always remember 90 lang sila. 90. Both of them. Stretch for IM, pinch for subcut. That's it. Everything is the same for IM and subcut and IM are very short procedures. When I was practicing the scales, it just took me about 9 minutes to finish my IM and subcut. Next is the PEAKFLOW. PEAKFLOW or peak expiratory PEAKFLOW measurement. So we will be using the PEAKFLOW rate chart or peak expiratory flow rate chart. If you want a copy of this, just click the link below. Everything is there. So inorganize ko na. I put it in a folder, so Google Drive. So all you need to do is just click and download everything. So that's all for you guys. Okay, for the PEAKFLOW, remember what I have mentioned earlier, yung hand na mnemonics. So that's hand washing, allergy, name, and then date of birth. Now, for our PEAKFLOW meter, or for our PEAKFLOW measurement, we need to add age and height. Okay? Okay, be mindful of your patient if your patient is a female or male, women or men. Here, pag women, it's in the lower part. Pag men naman, it's in the upper part of the flow rate chart. Now, so for PEAKFLOW measurement, as you can see, at the left side, you can see numbers. So this is the number of the PEAKFLOW reading. So this is, okay, there are numbers here sa baba, this age, and then the color is yung height ng patient. You are only using this PEAKFLOW rate chart to see and to know the target reading of your PEAKFLOW measurement. The target reading. If you have watched my previous vlog about administration of inhalation medication, they are kind of the same when it comes to the procedure kasi it's about blowing something. It's just that the PEAKFLOW meter, it has a gauge in the middle of the PEAKFLOW, and you have to instruct your patient that you need to bring back the needle to 0 every after reading. Yan. So you have to perform PEAKFLOW meter reading 3 times. Catheter sample urine. Catheter sample urine or CSU. Just the tip, make sure that you have to aspirate 10 ml of urine and then safely pour into the sample pot without touching the key parts. After getting the sample, you have to verbalize that your sample will be sent to the laboratory, and then you will fill in the microbiological form. Safely pour into the sample pot without touching the key parts. What are the key parts? The key parts are the lid, the inner side of the lid, the inner side of the pot, So, parang i-maintain lang natin yung sterility of the sample pot na dapat hindi siya ma-contaminate. So, next, you will verbalize that you will label the pot after putting it into the container or the sample pot. You verbalize that you will label the sample pot and filling the microbiological form, and then send it to the laboratory. Yun lang. And then, of course, ensure that the patient is very comfortable before you leave. Basic. It goes to all the procedures. So, verbalize that your area is clean, there's no discharge, there's no infection, and there's no need for you to clean it. Of course, you will ask if your invigilator will ask you to clean that, then you have to do it and show it to your invigilator that you know how to perform cleaning the site, okay? Or just need to use your gauze and the saline. Of course, you need to deflate the balloon and then remove it carefully. Just instruct the patient na breathe in and then breathe out. So as your patient is breathing out, you will rapidly remove your catheter, and that's it. If you clean the site before you remove the catheter, you are also expected to clean after removing the catheter, okay? But so this is the most important tip that I've been remembering until now. So when you remove the catheter, you have to check the tip of the catheter, okay? And then see if there's infection, if there's bleeding, pus or whatsoever, and never forget that. Empty your bag first, remove the catheter, check your catheter. Fluid balance, there's no need for me to talk about it. It's just the same as the thing that we do inside the hospital, or even when we were still university students. And intake, you write the intake in the intake column and then write the output. So intake and output. So it's a silent station. Just be very careful of your computation, because we are nurses and sometimes we really do need the calculator to calculate and compute the liquids. So next is the MSU, or midstream specimen urine. MSU, ito na naman yung scale na mag-i-instruct ka sa patient mo. Give a clear instruction. Very clear, simple, and clear instructions. So, of course, keep it short and simple. Just tell your patient that she needs to open the pot first, then clean her labia. Okay? Clean the labia, separate them with sponge, with water. So, yung sponge na moisten with water. So, she needs to separate the labia, and then one swipe technique, front to back. Tapos, tell your patient that she should start urinating and then pause. Then get the pot, get the sample. So that's midstream. Get the sample. After that, pause again, close the sample, and then continue urinating. You will do the analysis, kasi urinalysis dipstick. So that's it. If you want to download my reviewers for OSCE, you may download it. You may freely download it. Just click the link below the caption. And one more thing, I know that OSCE is changing soon, but I hope my tips are helping you. Always pray and always be confident. Always think that you're a nurse, you're a Pinay nurse, you're a Filipino nurse. We've been through a lot from our processing, from all the number of exams we've been through, IELTS, OET, CPT, our nursing licensure exam in the Philippines. So no doubt of you passing this exam. So good luck, guys, on your upcoming OSCE. Good luck to all future UK nurses. See you next time. Bye. Thank you for watching.